Hello students, welcome to the class. I'm Yogitha. So subject, yes, I can hear you. You should be a little more louder when you speak. Yes, it's psychiatric nursing. And today's concept is HIV AIDS. See, we are studying regarding HIV and AIDS and a problem what is faced by the patients. Now definitely HIV means human immunodeficiency virus. When we develop this condition and finally a patient will get a lot of physical complaints and they develop that acquired disease, that AIDS, acquired immunodeficiency syndrome, a lot of complaints, a package. We can call it a combo package. Now in this time definitely they will have a physical complaints. You may be knowing that, you might have studied that in your medical surgical nursing. You might have seen the conditions, you might have seen the patients definitely with the HIV AIDS, lot of physical complaints. But now we are going to focus what are the psychological problem they may face and how to deal with that. See, definitely if you're a med-surg nurse, we are thinking that how to deal with the patient. I should have that universal precautions, wear gloves, mask, you have a cap, don't directly touch the patient, you maintain the distance, you see the body fluid. See, we are thinking many things, but now we are thinking from the point of a psychiatric nurse, how you are going to handle the patient. So now let us have a little glance on this HIV AIDS. How do we develop the disease? Patient may get HIV because of blood transfusion, unsafe sex, any needle prick, or like a substance abuse patients, people, they may use the same needle for different people, or you had a very close contact with the patient, like you had a cut and wound, or the direct contact with that patient body fluids, chances are there. So these are the factors you may develop HIV AIDS. Now, when you come to know that you are HIV positive, how will be the reaction of an individual towards this result? Positive, HIV positive, that means you are a patient or you are the victim of HIV now. Now we can see changes, physical changes, emotional changes, their behavioral changes, changes in their social life, a lot of changes. Now how do they react? Now if you see the emotional change, like they will get sudden anxiousness, sadness, fear, they are worried, panicness, they're worried about the present and the future. They don't know how to handle this emotion. They may feel to cry, they may lose their mood, fluctuating of this mood. They're not oriented what to do, they're not able to focus, concentration, changes in their behavior pattern, they're not able to easily mingle with others, disturbance in their family pattern, their socio-cultural pattern will be disturbed, occupation they may find difficult, then they don't feel so easy to do their work, fear, they may have a fear of pain, death, or any, like if it is worsen, what is the last stage of AIDS, how I will survive, what are the problems, changes in their body structure and changes in their relationship, and like society, how they treat us. See, these all fears, they may intense fear they can develop. They may lose the interest, they may lose the interest in occupation, social relationship, a sexual relationship, they may lose the interest in like living, like gathering functions, any celebrations, and also chances are there definitely when they encounter that they are the victim of HIV, they may develop psychiatric disorders like severe depression, anxiety disorder, mania, many conditions they can develop. So these all are the reactions we can see when the patient has got this HIV. Also we can see anger, they become very restless, helpless, hopeless, they don't know how to ventilate their feelings. See, I have not done anything, I have not done any sin in my life, and I don't have any multiple sex partner, then how I got HIV? See, I may lose the control, I may get anger. So they may feel like restless feelings, they don't know how to handle, they feel that they are unfair, what has happened with them, it's unfair. So they get almost all kind of mixed feelings, anger. Now how do you deal with the patient? Very important that we will provide care to a patient. See, definitely we will provide a medical assistant to the patient to assess their condition, check the severity of a disease, we will do the blood investigation, and we will give like required medications. This is all medical basis we will follow. Along with that, we will go with the psychological treatment. We can go for counseling. It's very important to deal with the patient with counseling. Now, what's the need of a counseling? In HIV AIDS, what's the need of a counseling? In HIV, like we will counsel them regarding the disease, regarding making a test, result, information regarding how to manage the condition, and information regarding how they can improve themselves, how they can accept and live with that condition, how they can cope with the condition. For all these things, this counseling is important. Now, this counseling can be done in two phases: pre-test and post-test. Now, in pre-test, before you do the test, you are providing counseling to the patient. Develop a rapport with the patient, maintain the confidentiality, and develop the relation so that patient is feel comfortable to ventilate the feeling. Take a written consent that you're going to do a test. So now here, before they go for the test, you explain regarding the test. Explain regarding the test result. You may get positive, negative, or intermittent. What is that? So that you explain, and explain them what is the root cause, that from where they may got this disease, like causes, etiology of this disease, what are the clinical feature, what are the symptoms, medication, and once you do the test, how you must prepare yourself to receive the report. And talk to a patient in privacy. So provide physical and mental privacy to the patient. Provide a calm and quiet environment. The environment should be so comfortable so that patient is able to ventilate their feelings regarding the test. Before they do the test, all their emotion, feelings can be ventilated. So this is the way you have a close observation of your patient and motivate them to do the test. See, before doing the test, we can't confirm. It's not confirmed to us to talk about HIV AIDS. So before you do anything, we will motivate them, we will give a psychological support, we will stand with the patient, let them do the test. So these all things can be done before the HIV test, pre-test counseling. Definitely they'll go for the test now and we will have a result. Now after result, we'll be doing a post-test counseling. Now here, maintain the confidentiality, that's very important. And never ever tell the result over the phone. You have to tell the result to a patient face to face. Call them, talk to them, inform the result. After telling the result, is so and so, you are having your result here, this is positive, you are HIV positive. After informing the result, give a pause. Give some time for the patient to react. They may be silent, they may sudden change of their emotion, reactions. So you give enough time for the patient to express themselves in verbal, non-verbal, whatever the way. Let them speak up. So then automatically when they settle, now you can speak. You see the condition, you explain them regarding the condition, you explain them the status of their disease, you explain the medication, what is prescribed for them. Explain them how they can start a new life, because when they are HIV positive, they need to make a lot of changes in their life. From eating pattern, dressing pattern, relationship, everything they need to change a lot. They need to take extra caution when they take a result and when they live with the disease. And definitely they may face a lot of problem from the society. Social stigma can be seen. How they will cope with that. They are having a partner, life partner, how they will have a relationship with them. So whenever they have a sexual relationship, they need to use a condom. Advanced information has to be given to them so that they can protect their partner getting the disease. If it is a female lady, if she is conceiving, then the baby may develop HIV. How we can prevent that? All the information counseling must be given to the patient. How they can start their occupation. how they can maintain the good family relationship, social relationship, how they can keep up their self-esteem with the disease. For that, we need to provide a counseling, provide a psychological support to a patient, which is really very important. Also, very important, we'll maintain the confidentiality. Whatever patients say with trust, yeah, belief, we are not supposed to tell with others. That will help the patient to express themselves so that we can deal exactly what emotional crisis they are facing. Also, now here you develop a health plan. What are the interventions you plan for the patient? You need to explain that. You need to implement that in a patient lives. Also teach the patient how they can work with the family so that they can reduce the risk of like infecting others. So these all areas we have to focus when we give a counseling to the patient in post counseling period. Also instruct them not to go for any blood donation. Also inform them like if they have an open wound that must be treated, they should not go a direct close contact with others, so that even others may have an open wound because of this HIV positive patient body fluid, they may spread the disease. So in work environment, how they can take care of themselves, all the safety measures has to be explained. So this is how we can manage the patient with pre and post counseling. Now tips for the nurse when they work with the patient HIV/AIDS. See, definitely they may go for a lot of emotional trauma. It's not easy for the patient to accept when they're HIV positive. See, definitely if you tell me like I am HIV positive, I need a time to accept that. Now here we can provide a psychological therapies, provide relaxation and individual psychotherapy so that we can focus on the patient problem. Provide family therapy so that family must understand how they got the disease. It's not that all the time with the multiple sex partner, a sexual disorder, we got this disease. There are so many other reasons. Maybe a person who is a health worker, because of needle prick by mistakenly she might have got this disease. So here it's very important that you educate the family members regarding the disease so that they'll understand, accept the patient. Love and concern, care is very important for the patient. Otherwise patient may have a psychological breakdown. Social stigma may make the patient completely feel isolation and withdrawal. Completely they withdraw from the society. They may lose their life. Chances are there that they may develop a suicidal tendency and finish their life. So all these factors must be assessed. Have a close observation of your patient, maintain a good relationship, a therapeutic relationship, build a rapport so that you can talk to a patient. Also give all the advanced information to your patient so that they can deal with the condition. Stand with the patient, provide psychological support to the patient. Also, you need to discuss this HIV positive matter with the patient partner, sex partner, life partner, maybe a wife, a husband, so that they should come to know that what's the condition, how they can take all the precaution. So this is a way we can manage the patient with HIV/AIDS psychologically. This is all about to deal with the patient emotionally when they're suffering, when they are a victim of HIV/AIDS. I hope you understood. Please keep reading. It is a vast topic. You can write a lot on that. And I just given a brief on a concept so that you are able to understand something and write your 5 marks answer. So please keep reading. Enhance your knowledge. That's really a very good way to improve yourself. And keep watching. We'll learn some more concept in new videos. Time to say thank you and see you all.